Malawians have returned home from South Africa after being deported or voluntarily repatriated, leaving amid rising anti-immigrant tensions. Now, whilst much of the debate has focused on the humanitarian, legal, and economic impact, a public health expert says that the health consequences also deserve urgent attention. In an opinion piece, Dr. Mwai Makoka warns that disrupted treatment for chronic illnesses, growing mental health needs, and increased pressure on Malawi's healthcare system could have lasting consequences if they're not addressed. Well, joining us now is Dr. Mwai Makoka, who's an independent consultant on health, faith, and development, and he's based in Lilongwe. Thanks so much indeed for joining us, and welcome to the program.
Thank you. Thank you very much.
Perhaps we can start with what prompted you to write this opinion piece, and why do you believe that the public health implications of these mass returns home have been overlooked?
Yeah, I think, thank you very much for having me. And it has indeed been a huge undertaking when we see the number of buses and the numbers of people that have been repatriated and the emergency nature in which they have had to move back home. So as a medical doctor in those kinds of emergencies, we know that usually health matters may easily be overlooked. And especially those that are more vulnerable, those that are already sick, and the young women that are pregnant, they will suffer. And so I just wanted to highlight a couple of issues that are obtaining in this kind of situation.
Yeah, I mean, it seems as if there's quite a number of issues that are on the table. Things like treatment for HIV, tuberculosis, and other chronic illnesses interrupted. Why is that such a serious concern?
Many infectious diseases, actually, the positive outcome for treatment is based on adherence to treatment, taking the right medication and taking the right medication at the right time and without interrupting the medication. So whenever there's interruption of medication, usually the clinical condition will get worse. The symptoms may come back. When it comes to HIV treatment, we know that the CD4 count may start dropping again, and the viral load, the population of viruses in the body, the virus starts multiplying again. And while the individual patient may get worse, the chances of them transferring or transmitting the infection to others also goes up. And diseases like tuberculosis, in crowded conditions, crowded living conditions, the transmission is also high. So it is a concern that with that kind of disruption of medication and living conditions, we can actually have more breeding ground for infection and worsening of clinical conditions. And when also the treatment is interrupted and there's new transmission, we can actually introduce infections that are resistant, maybe which are new in this country. So as we travel, we carry with us infections. We carry with us bacteria and viruses that are in our bodies. And when we get to new places, we introduce them to the new geographical locations and the new populations that we're coming in contact with.
Sadly, we've run out of time, but I don't know if you can answer this one briefly. Mental health is another big issue, isn't it? One that's often neglected, but this is an abnormal time, and abnormal times often have consequences.
Yes, and the big worry is actually like of late, we have had rising cases of suicides in Malawi already. And we are already grappling to see how do we arrest it. And so now this is worsening, coming on top of a condition that is already worsening in the country. And coping mechanisms vary between individuals, but also networks that will help them to cope. Some were able to maintain social networks. We remember the word social distancing, which we wrongly used, but actually other people could be far, but they maybe maintained social closeness with friends and family. Others were not, maybe they had disrupted and strained relations with family members, spouses, and parents and siblings. So those are likely to struggle to resettle, while others maybe will come to be welcomed by friends and be supported. Some will have a sense of failure. They went to look for economic opportunities. Right. Maybe they did not manage to invest anything back home. Some had been there different time, maybe others much longer. Maybe others have only done a shorter stint. So there will be very different situations, and it is not easy to have a one blanket solution. So I think individual counseling, psychosocial support, and the social networks to come on board, to welcome them, to support them, being non-judgmental and be supportive. I would say that would help.
Dr. Makoka, unfortunately we've run out of time, but thank you so much indeed for your comprehensive analysis on the situation of these Malawian migrants. Thank you so much indeed for your time.
Thank you. Thank you.
That was Dr. Mwai Makoka, who's an independent consultant on health, faith and development based in Lilongwe, talking to us about the unintended consequences of moving so many people, repatriating them and deporting them at the same time. It's a little after 7:30, which means it's time for your news headlines with Jwalani Tulongwepe.
SABC News.